While many scientists are frantically working on a COVID vaccination, a group of Sydney researchers is focusing instead on cancer detection. For the first time, we can take you inside the Camperdown facility, adapting their capabilities to ensure access to a life-saving screening drug is not disrupted during the crisis.
In Sydney's inner west, one of the country's nuclear research reactors, home to high-tech medical trials and some of our brightest minds.
Anything new and novel in the world of radiopharmaceuticals, we like to get involved in.
But the facility is now pivoting from research to supply, responding to calls from doctors who fear we could face shortages of critical cancer screening drugs after a Darwin hospital was unable to access FDG, a radioactive tracer that detects cancer due to COVID-19 border shutdowns.
So in the case of Darwin, they couldn't get their normal FDG supply from South Australia. The flight from South Australia didn't exist anymore, however there were flights out of Sydney and Brisbane.
Australia's Nuclear Science and Technology Organisation is now in the process of getting TGA approval to produce the drug to provide a future Plan B. FDG isn't the only drug facing shortages should COVID-19 force another round of drastic border closures. So researchers are having to consider a variety of precautionary measures.
In the therapies, most of our supply comes from Europe or Asia, and we're seeing those supply chains being severely disrupted.
Researchers and the government now racing to secure air freight options and peace of mind for both doctors and patients. Amber Laidler, 7 News.